Okay, so good afternoon, ma'am. My name is Meryl Joyce Colong, and I am a second-year medical student from Davao Medical School Foundation. And today, I am tasked to examine your head and neck. And this is to assess whether there are any abnormalities related to your head and neck. Okay, so for the procedure, there will be different kinds of procedure. There will be procedures that are easy, and there will be procedures that you may find uncomfortable because I'm going to use the following apparatuses: the otoscope, the pen light, as well as the tongue depressor. Okay, but rest assured, all procedures are non-invasive. Okay, so before anything else, is it okay if I'm going to ask a little information about you? Okay, so what is your complete name?
I am Kyle Nicole Aguho,
Your age?
16 years old,
Single or married?
single.
Where's your address?
In Malinong's Kamantian, level 6.
Your occupation?
Student,
Your religion?
Roman Catholic.
Okay, so is it okay if we proceed?
Yes.
Okay, so first I'm going to assess or check your head, and I'm going to start with your hair. So for your hair, I'm going to check whether there is hair loss. I'm going to check for its texture as well as its distribution. And then I'm going to check your scalp, whether there is presence of lesions, scaling, bumps, presence of parasites, as well as lice. And then it will be followed by palpation of the skull, whether there's presence of deformities, depression, lumps, and tenderness. Okay, so I will start. So for the hair, there is no presence of hair loss. There is even distribution of the hair. Okay. Then the texture is smooth. But for the scalp, there is no presence of lesions, as well as scaling and bumps. There is no presence of parasites and lice. Okay, so now I'm going to palpate your head. Okay, there is no presence of deformities as well as depression. Okay, so there is no presence of lumps as well as tenderness. Okay, so now we will proceed to your face. Okay, so first I'm going to assess the symmetry of your face. Okay, your face is symmetrical. There is no presence of skin lesions as well as discolorations. There is no involuntary movements. Okay, there is no presence of edema as well as masses. So now, ma'am, I want you to open your mouth widely and then close. Do you feel any discomfort?
No.
Okay, so now let's proceed with the nose. So for the nose is symmetrical. There is no presence of skin lesions as well as discolorations. Now, next, I want you to, we have to perform the sniff test. So for the sniff test, I want you to cover one side of the nostril. You have to inhale and then exhale. Is there any difficulty of breathing? Okay, so do the same thing on the other side. Inhale, exhale. So is there any difficulty in breathing?
No.
None. Okay, so now I am going to use the stethoscope to assess the inner portion of the nose or the nasal cavity. Okay. So allow me to check. Okay. On the other side. Okay. So there is no presence of bleeding, scarring, or lesions. Okay. Now, so I'm going to palpate the paranasal sinuses. So first, I'm going to start with the frontal sinus, okay, and then the maxillary sinus. Okay, so there's no presence of tenderness. Now let us proceed with the mouth. So I'm gonna wear gloves, sterile gloves. And then I'm also gonna wear my mask. First, I'm gonna check your lips and the perioral area. Okay, so for the lips, there is no presence of lesions, ulcerations. Okay, the color is normal. And there's a little bit dryness on your lips. And then for the perioral area, there is no presence of lesions. Okay, let us proceed with the oral cavity. So first, okay, open your mouth. First, check for the presence of ulceration and lesions. Okay, there is no presence of ulcerations and lesions in the buccal mucosa. Then, in the posterior portion of the lips, there is no presence of ulcerations and lesions. Now, I'm gonna check your gums. So, for the gums, there is also no presence of lesions and ulcerations. Okay, for the teeth, okay, hand up. Okay, for the teeth, there is no presence of discoloration, there is no missing teeth. Okay, so now I'm gonna use the wooden tongue depressor. Okay. So you may find this uncomfortable, and I'm gonna do it fast so that you won't feel any discomfort. So please bear with me. So I want you to open the mouth. Okay. I want you to say one more time. Okay. So there are no presence of swelling, and there is no deviation of the uvula. Okay, next time I want you to bring your tongue out. One more time. Okay, so the tongue is symmetrical. Now I want you to put your tongue upward. Okay, allow me to check. Okay, there's no presence of lesions as well as ulcerations. Okay. So now I'm going to check or palpate your neck. Okay, so for the neck is symmetrical. There's no presence of skin lesions as well as discolorations. There's no presence of lumps. Now I'm gonna check or palpate your lymph nodes in your face. So let us start with the periauricular nodes. Okay. Next is the posterior auricular nodes. Okay. Next is the occipital nodes. Okay. Next, tonsillar nodes. Okay. Next is the submandibular nodes. Then, submental nodes. Okay. Then, the superficial cervical nodes. Okay. Next is the posterior cervical nodes. Okay. And then, deep cervical nodes. Okay. And lastly, the supraclavicular nodes. Okay. So far, there is no presence of nodules. Wala naman pong enlargement of lymph nodes. Okay, so now I'm gonna palpate your trachea. Okay, so for the trachea, there is no presence of deviation. It is in central placement. Okay, now ma'am, I want you to drink this water, but do not swallow it yet, okay? Okay, now, I want you to swallow. Okay. Now I'm gonna check or palpate the thyroid gland. So there is no enlargement of the thyroid gland. So far ma'am, there is no any abnormalities. Meron lang pong konting dryness sa lips. So, you can drink more water, lots of water. Hydrate para hindi na po mag-dry ang skin. And then you can also use lip balm to moisturize your lips. So, do you have any other questions? Okay, so thank you so much and have a great day.
Bakit di ba nakikita